So let's take a look at a case of an MRI of the head. So here we've got T2 weighted sequences. So we can see that there's hyperintense T2 weighted signal within the bilateral parietal occipital lobes. There's also some scattered areas in the frontal lobes. There's also this well-defined area of low signal within the left occipital lobe. So if we switch over to the flare sequences, we can see this much more clearly. So that bilateral symmetric hyperintense flare signal within the parietal occipital lobes. So when we switch over to the heme-sensitive sequences, we can see two well-defined areas of blooming artifact within the left occipital lobe here. So this is an example of PRES, which stands for posterior reversible encephalopathy syndrome. So PRES is a neurotoxic state where you get vasogenic edema within the brain. It's thought to occur due to inability of the posterior circulation to autoregulate sufficiently in response to acute changes in blood pressure. So this disrupts the blood-brain barrier, causing that fluid to seep out into the brain, most commonly in the parietal occipital regions, although the mechanism is not fully understood yet. It does occur in acute hypertension, for example preeclampsia, but it also occurs in other settings such as drug toxicity, renal failure, lupus, and many others, putting the idea that it's solely due to hypertension into contention. In terms of imaging findings, you get this bilateral symmetric vasogenic edema in the occipital and parietal regions in about 70 to 90% of cases. But the name is a bit of a misnomer, and it can be found in non-posterior distribution, mainly in watershed areas, including the frontal, inferior temporal, cerebellar, and brainstem regions. On heme-sensitive sequences, you can see microhemorrhages in about 9 to 50% of cases, and that's thought to occur due to microvasculature friability. In terms of management, it's mainly supportive with gradual lowering of blood pressure and stopping or switching any offending drugs. Most patients normalize in days to weeks, hence the reversible in posterior reversible encephalopathy syndrome.